Okay, so just a bit on systemic lupus erythematosus or lupus. This is another autoimmune condition where different parts of the body are attacked uh, by autoantibodies. Okay, so um, commonly in systemic lupus, there's joint involvement. So they'll have inflammatory joints or inflamed joints. So people can present with an assortment of joint swelling around their body. They often present with a butterfly rash to their face that you can see in this image. And lupus often attacks other organs in their linings. Okay, so it can attack the kidneys and cause nephritis. So glomerulonephritis from lupus. Okay, so where else can it attack? It can attack the lining, the outer lining of the lung, and cause inflammation of the pleura, which is called pleuritis. And if it causes enough inflammation there, you can get collections of fluid around the lung called pleural effusions. It can attack the linings of the heart, and you can get pericarditis, which is the outer layer or the outer sac that the heart sits in. And you can also get other areas of the heart that have autoimmune inflammatory attack. Okay. As well, in this condition, patients can get Raynaud's disease, which is that vasoconstriction that mentioned in rheumatoid arthritis. This can also occur in lupus, where there's vasoconstriction to the digits, and they get pale white fingers that are very sensitive to the cold. Okay, so really, I think of lupus as, again, it's a systemic inflammatory condition that attacks a number of organs very frequently. It attacks the kidneys, leading to glomerulonephritis. Okay. So systemic lupus. So there's a perfect picture of the butterfly rash. Okay. Um, so systemic lupus, yes, it's an autoimmune disease, and there's definitely a genetic link to it, meaning that often there's other family members that have the condition. Okay. And really, with these circulating autoantibodies in the system, almost any organ can be attacked. And just like rheumatoid arthritis, there's exacerbations, so flare-ups, and then there's remissions where it settles down. And they also have inflamed, swollen joints, okay, that will lead to lupus arthritis. I mentioned the glomerulonephritis. So the antibodies attack the glomerulus of the kidneys, and they cause inflammation of the kidneys called nephritis, so glomerulonephritis. And because the glomeruli are affected, blood starts to leak into the nephron tubules, protein will leak in, so we will see blood and protein typically in the urine. If you're leaking protein and you're leaking albumin, well, you're going to get edema of your body, right? So often they'll start to develop peripheral edema because they've lost their oncotic pressure as albumin is leaking into the urine. The renal failure, because of the gradual destruction of the glomeruli. Okay, so they'll start to develop renal failure from gradual loss of their nephrons. So we usually start with about 1 million nephrons per kidney, and with ongoing inflammation in the form of glomerulonephritis, they're losing nephrons over time. The pulmonary system we spoke about, where they can get pleuritis, which is a painful inflammation of the lining of the lung, followed by collections of fluid in the lung called pleural effusions. It's actually around the lung. The brain can be involved, and you can have all kinds of the antibodies can affect different parts of the brain that can lead to strokes, seizures, a variety of conditions in the brain. Okay. Okay, so I've mentioned a number of these, but let's just go through them. Let's start at the top right. So the butterfly rash of lupus, very common. Okay, goes over the nose and spreads onto the cheeks. Patients with lupus are often photosensitive, meaning the rash that they have will be aggravated by the sun. Okay, so photosensitivity is a part of the condition. At the bottom right, lupus nephritis, that's the glomerular nephritis, where gradual destruction of the glomeruli results in proteinuria and hematuria that we pick up on a urinalysis. Let's go to the bottom left. We spoke about Raynaud's disease, the vasoconstriction in the digits. I mentioned that the autoantibodies can attack the outer lining of the heart, causing pericarditis. Okay? They can actually also attack blood vessels all through your body, causing what's called vasculitis. So that's why they mention vascular inflammation. Let's look at the list at the middle left. So weight loss, fatigue is very common in lupus. Okay, so they have a chronic inflammatory condition. So fatigue is very common. The autoantibodies attack the joints, so they get lupus arthritis. And the autoantibodies also involve the central nervous system. We mentioned that, so it can lead to strokes and seizures in the central nervous system. And you'll see there emotional lability, so that's part of the CNS. In the lungs, well, we mentioned the pleural inflammation that I called pleuritis, and the collections of fluid in the pleural space called pleural effusions. Okay, so they can present with shortness of breath because they may have a collection of fluid in their lung. In the areas surrounding the lung, which is the pleural space. So they can present with shortness of breath, coughing. Okay, so I think of it as these antibodies can attack anywhere. Okay, what are the main parts I'm going to think of? The butterfly rash, the lupus nephritis, causing proteinuria and hematuria, the swollen legs because I'm losing protein in my urine, the sensitive skin in the setting of sunlight. Okay, they get photosensitive rashes. I think of Raynaud's disease and pericarditis. Okay, so that's what I think of. But over time, you'll start. This is a very generalized inflammatory condition. So you'll see it again next semester. Okay, so last slide on lupus. I've mentioned most of this already. So definitely more common in young women. Okay, by far. The autoantibodies that form these circulating immune complexes in the bloodstream. Okay, and what is actually attacked with these autoantibodies? Well, we do have a test for lupus, a blood test, because lupus attacks nucleic acids, which are part of DNA, and other molecules in the body. So we have a blood test called ANA, anti-nucleic antibody test. So if we're suspicious of someone with lupus, this particular test can help with the diagnosis. So an ANA is used to diagnose systemic lupus. The urine, we can test that for proteinuria and red blood cells. to try and pick up the glomerulonephritis, and often the bone marrow is affected in this condition. All the inflammation shuts down the bone marrow. The bone marrow is very sensitive to chronic inflammation. So they get anemic, they get low white blood cell counts, leukopenia, and they can get thrombocytopenia. Okay. I didn't mention these in rheumatoid arthritis, but rheumatoid arthritis is the same. It's a systemic inflammatory condition, and the bone marrow will also respond in a similar fashion with anemia and leukopenia and thrombocytopenia. Okay. So really, the confirmatory tests are these antibodies that we can detect in the bloodstream. Okay, so let's go on to another condition called scleroderma, which is increased fibrosis of body tissues, so throughout the body. Okay, so, and we don't really know the cause of this. We think the environment and genetics play a role, combined with the immune system, and the result is overproduction of collagen, resulting in fibrosis throughout the body. Okay, and when there's fibrosis, there's often calcium deposition with the fibrosis. Okay, so they get these painful deposits of collagen that become calcified, and it can be in the skin, it can be in the lungs, in the gastrointestinal tract, the kidneys, and if you can imagine that your hands are fibrosing, so you won't be able to move and flex your fingers very much, that can happen in the gastrointestinal tract, so they have difficulty swallowing because they're getting extra collagen in the esophagus with calcification, and that can lead to problems with peristalsis and movement of food down the esophagus into the stomach. The kidneys start to calcify and fibrose, leading to kidney failure. Okay, so a common cause of death in scleroderma can be renal failure because of all the fibrosis that occurs. Okay, like rheumatoid arthritis and lupus, they can also have Raynaud's disease to the hands and feet. Okay, but and I mentioned the next one already, the esophageal dysfunction. So the painful swallowing and difficulty swallowing. So dysphagia is difficulty swallowing, and it's due to the fibrosis of the esophagus. Okay, the skin of the hands and face becomes tight and swollen from excessive collagen. Telangiectasia are just the surface blood vessels that can start to be seen. Okay, and you can see them on the hands, the forearms, the lips, the face, and they're just dilated little capillaries on the surface of the skin. Okay, so think of all these different organs that are just fibrosing. Okay, so if fibrosis happened to affect the lungs the most, well, they're going to have shortness of breath, dyspnea, and it can lead to respiratory failure. Okay, so I think of scleroderma as just parts of the body having so much excessive fibrosis and calcification that it just can't be used anymore. So I think of it as starting in the skin with really tight fingers and swollen tight joints. So decreased use of the hand. It goes to the face, and then it goes down the esophagus and causes esophageal fibrosis, and then it can go to the lungs, and of course it can go to the kidneys, leading to renal failure. Okay, so at the top left, so systemic scleroderma is affecting the esophagus there, and you can see that the fluid that's in the esophagus, they're doing a dye test here. So it comes to a narrowing where the arrow is. Well, that's from scleroderma. That's caused fibrosis of the esophagus, and they can no longer get fluid or food down. Okay, so that's pretty serious. They're going to run into all kinds of gastrointestinal problems. Their kidneys are fibrosing, their lungs are fibrosing. Okay, so it's not a common disease, but it can be very severe as these different organs fibrose. Bottom left, we can see the tight facial skin and those little dilated blood vessels that are called telangiectasia. Okay. On the right, it's showing you the tight skin, the tight swollen skin that's affecting flexion of the hands. Okay. And that is from excessive fibrosis as well.